Welcome to Using Your Medicaid, presented by Indiana Family to Family. Indiana Family to Family is the parent-to-parent organization and family-to-family health information center for the state of Indiana. These centers are statewide, family-led organizations that assist families of children and youth with diverse health and mental health needs and the professionals who serve them. We provide information, education, training, support, and outreach. The information in this video is current as of February 2026. As with any resources or information, it is important to verify the information provided to ensure it meets the same needs as your situation. Managing a medical condition can be challenging. Be prepared by knowing how to use your Medicaid coverage when you need it most. Indiana has several Medicaid categories. Each one works differently, so it's important to know which type of Medicaid that you have. Here are some examples. If an individual is pregnant or a child under 19 with income-based Medicaid, they probably have Hoosier HealthWise, which includes a managed care plan through Anthem, CareSource, or Managed Health Services, also referred to as MHS. If an individual is under the age of 59, receiving Supplemental Security Income, also referred to as SSI, but not utilizing a Medicaid waiver, they probably have Hoosier Care Connect, which includes a managed care plan through Anthem, MHS, or United Healthcare. If an individual is receiving Medicaid waiver services, they probably have traditional Medicaid, which is also referred to as fee-for-service, and they don't have a managed care plan. If you're unsure which type of Medicaid that you have, you can call the Division of Family Resources at 800-403-0864. Many plans require you to choose a primary care provider, also known as a PCP. This is the doctor who provides non-emergency care, such as well visits or screenings, acute care for a minor illness, and diagnosis or treatment of a health problem. Your PCP can do an examination, order tests, and/or make a referral to a medical specialty. If a specialist is needed, you can then choose one that accepts your type of Medicaid. For urgent medical advice outside of regular office hours, you can call your PCP's after-hours number. But if you are experiencing a life-threatening medical emergency, call 911 or go to the nearest emergency room if you need help. To find a provider within your Medicaid network, you may call the number on the back of your Medicaid card or visit the provider directory link on your screen, also linked in the caption of this video. Some Medicaid participants are eligible to receive transportation services to and from medical and dental appointments. Call the number on your Medicaid card to find approved transportation in your area. It should be noted that some Medicaid packages are not eligible for non-emergency transportation. For more information on Medicaid transportation, visit our website and review our Medicaid Transportation Package A and Package C CHIP and Medicaid Transportation Traditional Medicaid fact sheets. All Medicaid plans cover early and periodic screening, diagnosis, and treatment, also known as EPSDT, Pediatric Preventative Care for Indiana children and younger adults ages 0 to 21. Some covered services include doctor's visits, checkups, shots, dental and vision services, inpatient and outpatient hospital services, medical supplies and equipment, which includes diapers with a prescription for children ages 3 and up, prescription drugs, laboratory and x-ray services, mental health services, emergency room visits, transportation, and more. Most covered services require a Medicaid prior authorization. You can find a list of plan benefits by visiting the link on your screen, also linked in the caption. Prior approval and prior authorization, also known as PA, is required for certain covered services to document the medical necessity for those services. The provider must show proof that you need the service before Medicaid will cover the cost. Examples that require PA include wheelchairs, elective inpatient admission, physical, occupational, or speech therapy, psychiatric residential treatment facility admission, transportation, some prescription drugs, hospice services, and much more. For Medicaid to approve the PA request in a timely manner and avoid denied coverage, the provider must submit all required paperwork correctly. Note that while many services require PA before services are provided, requests for PA can also be submitted and approved retroactively as needed for a covered medical service provided on a prior date. For persons on a Medicaid waiver, using PA is required before using the Medicaid waiver budget, as the Medicaid waiver is considered payer of last resort. You can contact your case manager about utilizing Medicaid PA services. You may be asking yourself, how does your provider get a PA for the services you need? First, your provider must assess your needs, so share all pertinent information about your condition with your doctor. Note that the provider also must verify eligibility to ensure that your Medicaid coverage is active on both the date of service and the date of the PA request. Be sure to bring your insurance card with you to all appointments to take steps to avoid any lapse in coverage. The PA process varies based on your type of Medicaid. The provider must follow the protocol for your particular plan. All covered prescription drugs require a physician's order or prescription and may require a special PA form and some supporting medical documentation. A pharmacy that participates in your Medicaid plan can help with securing the PA. Home health services require a PA and a detailed plan of care. Medicaid may cover skilled nursing or home health for persons up to age 21, while the primary caregiver does a non-respite activity such as work or school. If the participant receives Medicaid waiver services, home health providers and waiver providers must coordinate with the plan of care. Additional information on this topic, as well as others, can be found on the Indiana Family to Family website. For one-on-one support, you can complete the form found on the Connect page of our website, call 844-323-4636, or email info@inf2f.org.